Welcome to the 11th edition of Medical Reality Talk Show with ICMFEL. We are excited to be back here today with you. So keep tuned. We will be coming live in a couple of minutes. And today we are discussing cervical cancer. So welcome to join us as we have this very important discussion today. Welcome everyone joining us from Facebook, YouTube, Twitter. We want to say welcome to this 11th edition of the Medical Reality Talk Show with ICMFEL. We'll be back very soon. Keep tuned. Welcome. We sorry for the delay. We now have our guests with us, so we'll be starting very soon. We want to say welcome to all of you joining us. Welcome to our guests with us in studio. And we now want to begin. We already have some little bit of delay, so we're going to start immediately with an opening prayer. So let us pray. Lord, we want to thank you for another opportunity to gather on this edition of our talk show and discuss uh, important medical issues to be able to be a help to our listening audience and also share knowledge and shared resources. We pray that this is going to be another fruitful discussion today. In Jesus' name we pray. Amen. So I have with me in studio some special people from ICMFEL. So I'm going to be recognizing them quickly. Uh, the organizing team of ICMFEL. So I have right here with me today, joining all the way from Accra, Ghana, as my co-host, Dr. Eleanor Anante. So we want to say welcome, Dr. Anante.
Thank you very much, Dr. Ballah. It's an honor to be here.
All right. So Dr. Eleanor Anante is joining me from Accra, Ghana, and she is my co-host today on this talk show. I also have with me in studio Dr. Faustin. Dr. Faustin is joining me from Guangzhou. And I also have Dr. Victoria, also joining me from Guangzhou. Dr. Mogata Niemeni Flomo, also joining me from Guangzhou. So these are the organizing team, member of the organizing team, and it's good to have you guys joining me in studio. Now I'm going to be introducing our special guest today. who is also already here with me in studio. So she's special, so I have to take my own time to introduce her. I don't want to make mistake. Yeah, so we have joining me here all the way from Liberia, Monrovia, Liberia. She's supposed to be joining from Accra, Ghana, but she's in Liberia. So she's joining me from Monrovia, Liberia. Dr. Deddeh EP Supuwood. I don't know what that EP stands for. Maybe she will tell us later during the discussion. Yeah, so Dr. Supuwood is a female, actually Liberia's first female oncologist in training. She's training at the Cancer Institute in Cairo, at Cairo University in Egypt. She's a graduate of the Cottington University and also the AM Dr. T College of Medicine in Liberia. She has an interesting story behind the white coat. I'm not going to go into that today. And this is not her first time on our show. She was here before, and we had a wonderful discussion. And we thought it was good to bring her back today again to discuss cervical cancer. So Dr. Supuwood is very passionate about her work. She's passionate about helping people living with cancer, and in fact, being a medical oncologist, that is her dream. With fascinating story behind what motivated her to take that path of specialization. And so we are honored today to have joining us in studio, Dr. Deddeh Supuwood. I'm going to be showing her real face. Emmanuel likes to say real face. But yeah, you can see this beautiful lady picture right there. She's the one joining us in studio today. I think she's ready now behind the camera. I'm going to bring her on stage to welcome. Welcome, Dr. Supuwood.
Thank you, Dr. Ballah and team. I'm excited to be back. Thank you. And Happy New Year.
Yeah, Happy New Year, and thank you for joining us today. It's not easy to be able to get doctors for this kind of discussion, very busy and different things happening around. So we are honored to have you joining us today for this very important discussion. So you are here with me today, and my co-host, Dr. Eleanor Annang. So we have the other people in the studio, but yeah, we're going to be having a wonderful discussion today, and we hope that our listening audience will be blessed. So to not waste any time, we want to go straight to our discussion for today. Like I said, we are discussing cervical cancer. Today we are discussing cervical cancer, and it's good to have Dr. Supuwood with us, who is a specialist in that field. We are all doctors, but yeah, everybody have their area, and we want to not just provide you fragment of information. We want the specialists to guide us as we go along the discussion today. So, Dr. Supuwood, you are welcome again. To start the discussion, I think we want to know what is cervical cancer?
Okay. Thank you, Dr. Ballah. So, in short, cervical cancer is cancer that affects the cervix. Cervical cancer is cancer that affects the cervix, and the cervix is part of female reproductive system, is an organ in the female reproductive system. It's like the lower part of the womb, is located between the lower womb and right before the vagina starts. So right at the end of the womb, in between, before the vagina starts, that little organ right there is the cervix. So any cancer that affects that place, that area, is what we refer to as cervical cancer.
Okay.
You want me to go further? I thought you were going as we asked the question. So if you
Yeah,
want me to
sure,
continue,
we're
I
going to
can
be asking
continue.
you. Yeah, no, it's okay. We're going to be asking you. Sorry,
Okay.
Dr. Eleanor, are you here with me? We can hear you, Dr. Eleanor.
Oh, I was muted. Sorry. So Thank you very much, Dr. Supuwood. Would want to know more about the anatomy, because sometimes patients come in and they tell you that my vagina, my cervix, they don't know the difference. So if you can be a little more elaborate on the anatomy of the vagina, I would really take.
Okay, so I am not a gynecologist, but from the little anatomy I remember, yes, from the little anatomy I remember, I know that the cervix is the lower part of the womb, the uterus, which is the womb, and it is located between the lower part of the womb and between right where the womb, like it's ending and before the vagina starts, there's a little organ right there. That is why we refer to as the cervix. In terms of function, what the cervix does is that the cervix produces a secretion that we refer to as mucus. And during the female reproductive cycle, this mucus, it takes on different characteristics. So normally the mucus will be thick, and the purpose of this mucus is to protect the womb from invading bacteria and other harmful substances that will go into the vagina, the cervix, the womb, sorry, and affect the womb. So the cervix produces this mucus and it protects the womb, and it also prevents the sperm from entering the womb also when it's not supposed to. So yeah, and then during the birth process, the cervix, we hear when we take women to hospital, we hear the doctor saying, "Oh, she's 5 centimeters dilated, she's 3 centimeters dilated." So actually referring to the cervix, that part of the birth canal, it opens. So the cervix also is a part of the birth canal, and it opens and allow for the baby to pass through and come out during a normal vaginal delivery. So yeah, basically that's the cervix right between the vagina and the womb. That little organ right there is the cervix. Yeah.
All right, thank you. So that means, in effect, it's not something that you can see with your eye and say, okay, there is a wound on my cervix, so I have to go to the hospital. So it's not something the lady can actually see. It's something you have to go to the hospital for the doctor to examine before you get it.
Yes. Normally, the cervix cannot be seen externally when you go to the hospital. However, the doctors have an instrument that we refer to as a speculum that you insert into your vagina and extend it up, and like to screw it and open it also to review the cervix, to view the cervix in the hospital. Doctors usually use the speculum. But that one is the gynecologist. They can go further into that discussion. That probably there are other instruments that they can use to view the cervix. But I know that one of the instruments they can use is the speculum that you can screw open, and then you just look up there. The cervix will be there. It usually looks like almost like a donut shape with a little hole in it, something like that. It's supposed to be closed. So yeah, please, that topic is for the gynecologist. So
Alright.
if people
Sure.
want to know more about that, yeah, they can go more into that with the
Okay.
gynecologist.
So you've told us what cervical cancer is, right, Dr. Ballah?
Yes.
Yes,
So
yes.
So
I said that the
if you
cervical
can,
cancer starts
yeah.
from any cancer that originates from within the cervix. Yes, is a cervical cancer.
Are there any causes of cervical cancer? What causes it? Any organisms? Anything that causes it?
So basically for cancers, most times the cause of cancer is not really known. Most cancers, the causes are not really known. However, there are things that will increase your risk of developing cancer. And for cervical cancer, the most widely studied risk factor for cervical cancer is the human papillomavirus. This virus is a virus that can be sexually transmitted. So and it has several studies have shown that the human papillomavirus is responsible for up to about 70% of cervical cancer. So yes, being exposed to the human papillomavirus is a risk factor for developing cervical cancer. If you have multiple sexual partners, you are also at risk of developing cervical cancer. And this goes back to the human papillomavirus, because if it is sexually transmitted and you are being exposed to this virus, your risk of contracting this virus is increased because you have several sexual partners and you are having unprotected sex. It increases your risk of contracting this virus, which also increases your risk of developing cervical cancer. Another risk factor for cervical cancer is smoking. So we all know that, or if you don't know, smoking is responsible. It increases your risk of several different types of cancers, and the cervical cancer is one of them, because the cigarette smoking has a lot of substances in it that we refer to that they refer to them as carcinogenic, meaning they have the tendency of increasing your risk of developing cancer. So smoking is another risk factor for developing cervical cancer. Another risk factor for developing cervical cancer is if you have an immune or weakened immune system. For example, people who have had transplant organs, they had to, like, receive transplant. So usually when you receive a transplanted organ, your system, your immune system is suppressed for a while by being given steroids and other medications, because if it's not suppressed, your organ, your body will reject the organ. So in order to prevent rejection of this new organ that has been transplanted, your immune system has to be suppressed. So if you have received a transplanted organ before, that means your immune system is being suppressed, so you are at increased risk of developing cervical cancer. Another way in which your immune system can be weakened is if you are taking steroids. It's another type of drug that also it has an effect of suppressing your immune system too. So if you're taking steroids, if you have transplanted organs, if you have any kind of illness that suppresses your immune system, like for example, if you're a cancer patient that's taking chemotherapy for maybe something else, your risk of developing cervical cancer could be increased also. Yeah, so yeah, basically that's it. The other ones go back to having multiple sexual partners, which again I already said increases the risk of you contracting the human papillomavirus.
Yeah, Dr. Supuwood. Thank you for that details explanation talking about the causes, right? But then kind of the way you put it together, maybe for the layman, I know we later come to the risk factors. So how can you differentiate in this case risk factors and causes? Because people may probably get confused. You talk about multiple sexual partners, right? Is that a cause or a risk factor? Talk about smoking. Is that a cause or a risk factor? So will you want to kind of differentiate that?
No. Okay, so when we talk about cause is something that it's known, so that if you do this or if this happens, it will cause this. It will lead to this. It will lead to cancer. And like I said, most times the causes of cancers as a whole, they are not really known. Most times the causes of cancer are unknown, because cancer is like a genetic disease that there are several abnormalities that are taking place down at the molecular level. There's something in cancer theory called the double hit theory, but I'm not going to go into that. So cancer is basically a genetic disease, genetic, because whatever happens to you, it has to affect your genes down at the molecular level in order for you to develop the cancer. So the known causes of cancer is not fully understood, and the known cause of cervical cancer is not fully understood. However, when we talk about risk factor simply means that these are things that if they are there, you could develop cancer. They could be there and you might not develop the cancer. So it's not all in all cases, like even the human papillomavirus that we all that I've said is a very widely known risk factor for cervical cancer. If you are sexually active and if you have unprotected sex, you stand a risk of contracting the human papillomavirus. If literature has said that there are a lot of people who do contract the human papillomavirus, but they do not develop cancer because the immune system fights the virus. Yes. So, however, there are some people who will also contract this virus and on to develop cancer. So, risk factor does not mean that if it is present that you will get it. However, it means that if it is there, the chances or the likelihood of you developing cancer
increases.
Factor for cervical cancer. So when we hear risk factor, we should know that, okay, even though it is there, it's like maybe a 50-50 chance of developing it or not developing it.
So taking you back to the causes, the etiologies. So in short, these are things that you know if it happens, the possibility, not just possibility, but you stand a risk of having the disease, right? And thank you for that
Yes.
anatomical review, even though you said you're now a gynecologist, but that was a good one. So I don't want to go there either because I'm far away in the brain. So
Way up
I
there.
don't want to go. I don't want to go there. Even though we all studied, the anatomic, as general practitioner, we practice as general practitioner. But yeah, that that
But
that
we
re-
will
that,
leave
that
it to
respect
the
the
gynecologist.
gynecologist. Yes,
Yes, exactly.
and leave that for them. Yeah. So thank you for that. Yeah. Somebody said in the chat room, the survey is to get men to the uterus. That's
Yeah.
interesting.
Yes, that's true. I mean, realistically speaking, I would say that's true, yes.
Yeah. Okay. So thank you for that. So going back to talking about the causes and differentiating it from the risk factor. Stay on the causes. Eleanor, do you want to come in there?
Yeah.
All right. So now coming back to the risk factors, I think this is kind of interesting, especially when the question about the anatomy were coming in. It's easier to just kind of think that, hey, this is women issue, you know. Cervical cancer. Well, what that got to do with me as a man? So what what role men get to play in terms of reducing those risk factors?
Oh, yes. Thank you for that question. Men have a very important role to play in helping we women prevent cervical cancer. And the role they have to play is to stop being promiscuous. Because, yes, because if you are a promiscuous man, you have multiple sexual partners, and you are not practicing safe sex, trust me, you are increasing the risk of your partner, your wife, contracting the human papillomavirus. Because, like I said, a lot of people do contract the human papillomavirus, but they will not develop any symptoms. So, as a man, if you are a promiscuous man, and you're sleeping around and you're chilling with the big girls and the big boys, and you're having
I
unprotected
like
sex,
that.
you are increasing the risk of your wife. Yes. You are increasing the risk of contracting this virus, which of course you will pass on to your wife. So how do men help us is that please stop being promiscuous. Please practice
Wow.
safe sex. That way you will be helping us a whole lot with preventing cervical cancer.
Men, I
That is
hope you
what
are
I have to
listening.
say.
There is a plea here. Please stop being promiscuous. So it's not just women issue. Wow. That's this the cervical cancer is not just women issue. It also men has very important roles to play. That's very important. So it's kind of easier, right? To kind of think that, well, what I get to do with that? I don't have a service, by the way, so it's none of my business. But yeah, we are hearing that. So men can also carry the HPV, right? You can carry the human papilloma virus. And if you carry the virus, that means you can be able to infect the females you will be, having sexual relationship with. So if you are a male who have multiple sexual partners, definitely you're going to be
Please stop.
spreading it around, right? Especially if you're not practicing safe sex, right? So, and of course, I'm concerned about that because you're going to be like, you're a neurosurgeon. What you get to do with the whole, cervical cancer business? Well, it could get metastasized, right? Dr. Supuwood.
Yeah, I mean, cervical cancer, it can metastasize. It can
Yeah.
metastasize to the bone. It can spread through the blood. It has the tendency to go, you know,
So
anywhere.
it could come
So
to the
there's a possibility
brain.
that it is spread up to the brain, the patient
Of course. So
will
I
end up
don't
to
want
you.
you
So
can,
yeah, you should be
yeah.
concerned.
So it should be my concern. So the next question: how common is cervical cancer globally and maybe specifically in Liberia? You being you can Liberia first oncology and then a female. Well, I think you have an idea as to what you're going to be dealing with, right? How common is cervical cancer in like globally, and then Liberia specifically? You want to say something about that?
Okay, so globally, cervical cancer is the fourth most, according to WHO report on cancer in 2020. Cervical cancer is the fourth most common cancer amongst women, and in 2020 there were about 600,000 plus new cases of cervical cancer that were reported in 2020. In Liberia, cervical cancer is the most common cancer amongst Liberian women. So in 2020, Liberia reported about 3,552 new cancer cases. And all of these 3,552 new cancer cases amongst the females, cervical cancer recorded 56 new cases. So, and that accounted for about 30% of the number of cases that were reported in Liberia. So, cervical cancer in other parts of the world, breast cancer is the most common cancer amongst women, but in Liberia, cervical cancer is the most cancer amongst Liberians. So this is why it is very important to me. It is very important. It's very important that we, pass the message on and spread the news about how can we avoid and reduce our risks of cancer, cervical cancer. So yeah, it's the most common amongst Liberian women, and this is why it is very important that we talk about this not just today but every day.
So is there something we can do about it, or is there something we're not doing that is why the cases keep increasing? How do we, apart from talking online and talking on media, what else can we do to, like, with the awareness
Yes.
creation?
So back in 2021, towards the end of 2020, I think it was around November last year when I was in Cairo, I saw on Facebook that the Ministry of Health was they were dedicating, they had constructed a facility and that was dedicated to breast cancer and cervical cancer screening. And I was really excited about that. So yes, in cancer management, early detection is very important. And when it comes to cervical cancer, it is very, very important that we do early detection. There are methods in which that we can use to do the early detection and prevention. So awareness for me, when we talk about cancer, I always like to start from awareness, because I always say that if you know what you are looking for, you will know when to present, because early presentation is very important, early detection is very important. So yes, it is very important that we do a lot of awareness about cervical cancer. I know there are other people doing uh, 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 doing work surrounding cervical cancer its awareness. I just can't recall the names right now in the institutions, but some public health of Liberia, something is doing something about cervical cancer awareness. I have seen the post couple of times. So Liberia, we need to do more. We are doing better than what we used to do a couple of years ago, but we can do even better than that. So yeah, awareness, a lot of awareness, going to the marketplaces, making people understand what cervical cancer is, and just letting people know that, hey, there's something called cervical cancer, and letting them know what are the signs and symptoms. Who will get there? I see someone asking about signs and symptoms, so we will get there. So awareness is very important, so that yes, as long as like make people aware that this is what can happen, and then they present early, you have better outcomes. So awareness, we start from awareness. and early detection and screening. Yes.
So I think somebody already jumped me the gun. We're coming right there to what are the talking about clinical presentation. What are the most common symptoms for cervical cancer, and specifically, I think we want to know why we term the red flag, right? If I think they are in Liberia, in West Africa, where malaria is common. The moment you get fever, the first thing you think about is not COVID-19. It's probably malaria. It's just now COVID is changing the story, right? If you get fever, then you start thinking otherwise. But well, everyone would be like, hey, I get fever. I think it's malaria. People even get bad of like, you don't want to go to the hospital and just take medicine. I get fever. I think it's malaria. So that's a red flag. I would term it that way. So I think talking about this, one of the things we want to do is so people can have like, that very basic information in their mind. You don't have to be doctor, but like, okay, I think this is something I should run to the hospital and see your doctor as a female. So what are the most common symptoms for cervical cancer?
Okay, so we talking about cancer that affects the female reproductive system, right? So the most common presentation definitely would be abnormal bleeding. Abnormal bleeding. So for women, if your menstruation is heavier than normal, and if you're experiencing menstruation period, blood flow that is heavier than normal, that's a sign of, that's a sign, is a symptom. If you're having bleeding in between your periods, so like when you finish receiving and you're supposed to, as a female, there are period days when you're not supposed to have blood in your menstrual cycle, but then you realize that there are days in between that you start to bleed again, that's another symptom. So bleeding in between periods is another symptom. If you're having painful sex is not supposed to be painful. So if you're having sex and the experience is very painful, you experience pain during sex, is another symptom of cervical cancer. Another symptom of cervical cancer is having this foul smelling vaginal discharge. It's, stink. The odor is really bad, and you're having discharge. It should raise concerns that you should visit your doctor. Also, if as a female you are bleeding, you are receiving, and your menstruation goes longer than it normally does. Like for example, if you normally receive for 3 to 5 days, and then you start to receive for between, let's say, 7 to 10 days longer than normal, that should also raise a sign to you that, hey, something is not right. Let me go and visit my doctor. So yeah. And then for women who have reached the menopause, if you don't know, for those who don't know what menopause is the point in a female's life when she can no longer, when she has passed her reproductive years. So once a female has passed her reproductive years, that means she's not supposed to receive any more. Her menstruation is supposed to stop. But if you have received your menopause, or you are in your menopause period, or you have reached your menopause, and then you start to bleed, that should also raise a concern that, hey, something is not right. So, let me go and visit my doctor. So in short, any bleeding that raises concern to you, foul smelling vaginal discharge, and of course painful sex, those are all red flags that should raise concerns for you to visit a doctor as soon as possible. Now, there are, like I said earlier, the cervix is part of the female reproductive organ. So experiencing this does not mean that cervical cancer. You could be experiencing something totally different that is affecting your female genital tract. Yes, but because this is an organ in the female reproductive system, they all have, similar presentation. So when you experience it, your doctor. Yes. I don't want people leaving from here and saying that doctor who say when I bleed at me, abnormal bleed at me, I get cervical cancer. No, it means you should go and visit your doctor. Because people can misinterpret people. Yes, so I wanted to be clear. Yes, so if it happens to you, any abnormal bleeding, please go and visit your gynecologist, and then they will take it from there. If you have painful sexual intercourse, if you have abnormal foul smelling discharges, please visit your doctor and, start it from there.
All right. So just to add to that, what you're saying is these symptoms, they are in a much they are unique to cervical cancer, but they could also be presentation of other gynecological diseases. Yes. So that's gonna. There is a question in the chat room that I'm gonna bring on the screen for you to talk about. Somebody talking about the statistics you were talking about from Liberia. But before
Yes.
we go to that, I want you to tell us how do we, maybe so people can have an idea, how is cervical cancer diagnosed? We know it is the gynecologist who
Um,
usually will maybe first see this kind of patient, but yeah, as an oncology, maybe before they get to you, or if you have the opportunity to be the first person to see them, how is it diagnosed? I think you should give a picture of that.
okay, so cervical cancer, the most common test that is used for cervical cancer is what we refer to as the Pap smear. So it has some long name, Papa Nicolau smear. I hope I'm getting it right. I'm not sure, but in short, it's Pap smear. You can just Google Pap smear, and then they will give you information about it. So the Pap smear, to do the Pap smear is like you visit your doctor, and he or she will insert. If you present and say, "Oh, doc, I've been having this abnormal vaginal discharge, I've been bleeding, having abnormal bleeding," so visit a doctor. They will do the pelvic examination using the speculum, the instrument that will be inserted into you and open. And then there's the Pap smear. There's a brush, that specific kind of brush that is used, and it will just use it to brush the cervix a little bit and scrape a little of the walls of the cervix, and then they will use it and send it to the pathologist, who would then look at it and put all the different stuff on there and use it under the microscope, view under the microscope, and then he will be able to say whether this is cancerous or not. Then there's also another way that you can know cervical cancer. It's called another machine that you can use called the colposcopy. I think scopy is insert some camera, small video camera or something like that into you, that it will look and the person will review the inside of your cervix, and see areas that are abnormal, and then they will collect specimen from there and send it. So basically, those are the two major ways that they can send it. But cervical cancer and any type of cancer diagnosis has to be made with a pathological report.
Pathology.
So
Okay.
even if
That's
I'm suspecting, I have to send the whatever to the pathologist for him to be the one to look at it and tell me, yes, this is cervical cancer. So cancer diagnosis cannot be made without a pathologist report. So whatever I'm describing here, the pathology has to be involved in it to,
be
at the end of the day,
involved
review
to
on the microscope and yes, and
evidence.
say, yes,
Yeah.
this is definitely cancerous. Yes, yes.
So
I think
it's I think one of the reasons this kind of awareness is important. It kind of help give us picture of what happening around the world as well. So somebody, I'm saying that in connection to the statistics you are giving, to give us a picture of how why we should be concerned about cervical cancer. By the way, and somebody is asking. They're worried. How do we come up with that figure from Liberia? Because they think Liberia is limited with resources to be able to even screen or test for cervical cancer. So they don't trust, this kind of information or numbers from Liberia. Do you want to say something about that?
Yes,
Because you're going to work in Liberia, because you should have this picture. Yeah, this is the most common Liberia. You just concluded that. So somebody is saying, how sure are you even the most common? So they're looking at numbers here.
yes, I agree that it's possible that cervical cancer could not be the most common cancer amongst Liberian women, simply because we are underreporting. That is the truth. So for a long time, Liberia has not really been doing much. We know that our health sector is not really equipped. So there are a lot of things lacking. Hello?
Yeah, we can get you. Please.
Okay, there are a lot of things lacking in our health sector. So yes, I believe the numbers being recorded are lower than what is actually seen in the hospital. But then, as it is, Liberia has not been doing a lot in terms of cancer. So it's over the last couple of years that we have started trying to, report on cancer. So yes, the number is low. I believe if we go back to the status quo and actually, go back, start from the beginning, start with awareness, because people don't know a lot about cancer. Once upon a time when I went for my study, when I just went to Egypt to start my program, someone reached out to me, a friend of mine, we were chatting, and he asked me, he said, "So what is it you are studying in Egypt?" And I said, "Cancer." And the question he asked me, he was like, "Do we even have cancer cases in Liberia?" And interestingly, yes, interestingly, this is someone who was very educated and master's degree holder. And when he asked me that question, I smiled and I told him, I said to him, I was not being rude, but I just said that question is being asked out of ignorance, because yes, we do have cancer cases. So yeah, that is why we have to go back. We have to start from awareness, because as long as we inform our people that there's something exists called cancer, and the earlier you present, the better your chances of surviving, especially in a resource limited country like Liberia. I strongly believe that the numbers will go up. So yes, the numbers that we are reporting now, they are low. But in the next few years, when we start to do more, and we are doing more now, when we go back to the table, we will see that the numbers will definitely increase. So yes, I do believe that the number is being underreported, but that is what we have for now. So that is what we are working with, and with the hope and intent to improve and build on what we have now.
So, Dr. Annang, you want to say something about Ghana? we have dominated a conversation with
Yeah.
Liberia.
I think it's similar. People don't believe that cancer is in Africa. Recently, we diagnosed a patient with cervical cancer, and she was shivering. She couldn't sleep because she thought that was a death warrant, which it's from society. Once we hear cancer, we think that is it. That is the end of our life. So people don't report when they after they don't do an after or follow up again. Once they hear they have cancer, they don't come to the hospital again. So I think what our doctor was saying, she's right, is underreported. They'll rather die at home when they have cancer than go for a follow up. So we don't even get to know the figures well. Yeah. So I think the awareness creation is very important. And then talking about that, with the management, I want to ask, how do you manage this case? Is it curable? From the chat box, someone is asking, is it curable? And if it is curable, are there any medications or some therapies you have to go through? Is it better to present early or late, or like how would you manage it in the early stages and then in the late stages?
Yes, every type of cancer, it's better that you present early. So I wouldn't want to say, when I come on live, I'm very careful with the message I give out. So I wouldn't want to say it is curable, but what I would want to say is that early presentation gives a better chance. So if the patient presents early, the chances of them having a better outcome is better as compared to if you present late. Now, cancer management, I always like to tell people that cancer management has to do with, it depends on the staging of the cancer. Yes, so there are different ways in which you can stage cancer. If you present early, then the earlier your chances, the better. So, in summary, stage 1 cervical cancer is where the cancer is limited to the cervix. It's just in the cervix. If you present with an early cancer of the cervix, that stage 1 that is just in the cervix, there are surgical. You can do surgical management. So there are different surgical methods. There's a procedure called loop electrosurgical something. procedure. So it's LEEP, and it's a surgical procedure. Then there's another one called colonization, wherein it's for early cervical cancer, where you can go in and take part of the cancer, part of the cervix out, that is, where the cancer is. It's, they take it out in a cone shape using knife. That one is for the surgeons to explain further, but it's a surgical procedure. Or you can do a simple hysterectomy, where you will remove the womb and the cervix and not all of the other surrounding structures. So if you present early with a stage 1 cancer that is confined to the cervix, possibly, yes, it will be cured, but I wouldn't want to say use the word cure. I would rather prefer to say that you stand a better chance of long-term survival if presenting early. Stage 2 cancer and going further, you have to manage them a little bit differently. So stage 2 cancer and to stage 4, you give them chemotherapeutic drugs. That's where I will come in, where you have to treat them with chemotherapy, the drugs, and sometimes there's another management of cancer, another type of management of cancer called radiation, wherein you expose the patient to radiation, beams, rays, and that one is a complicated process. But radiation and chemotherapy is usually used for stage 2 to stage 4. Sometimes stage 2, you can also do, say, hysterectomy, radical hysterectomy. So that is where you remove the cervix, the womb, and the fallopian tubes, the ovaries, that like move, almost like removing the entire female reproductive system, almost everything. So management of surgery of cancer, of cervical cancer, it depends on the stage. So stage 1 is limited to cervix. Stage 2, the cancer has spread beyond the cervix and it has gone to the upper part of the vagina, because, like I said from the beginning, right, the cervix is between the lower part of the womb and the beginning of the vagina, right? So if it spreads from the cervix down into the vagina, the upper part of the vagina, it becomes stage 2. If it spreads beyond the cervix and goes to the upper part of the vagina and goes to the lower part of the vagina and also spreads to indoors, it becomes stage 3, and with affects sometimes it can even affect the kidneys, where you have fluid, hydronephrosis fluid in the kidneys, right? Yes, so hydronephrosis, if the kidneys become involved with fluid in it, then it's a stage 3. Stage 4 is where the cancer spreads to the rectum and the bladder and to any other distant part of the body, then it becomes stage 4. So the higher the stage, the more difficult it becomes to treat the cancer. That is the reason why presenting early is very important in cervical cancer and any type of cancer management. So yeah, that's it.
Okay, so this is not to scare people, but I think people need to know how why it is, because sometimes we have all these talk show, even especially close family. You talk and see everything, but people like, okay, and I think you guys, you doctors gonna experience that. Your close friends, yeah, those who you went to school with, your high school classmates, people who are very close to you, when you're giving them medical advice, like, okay. So, but sometimes
My uncle always
sometimes
said to me, I'm not going to give him I will send you somewhere else.
yeah. So sometimes I even try to like crack my head, like, okay, go to the hospital. Yeah, but what one question is, what are some of the complications? And like I said, it's not to scare people, but to fight. People need to know how terrible this is if it is left untreated.
Yeah, the first complication I would say is associated with cervical cancer is fertility, because it's part of the female reproductive tract, right? If left untreated, or even if it is treated, I mean, you're removing the cervix, which is part of the womb, the female reproductive system. So I would say infertility, because if it spreads to other parts of the tract, reproductive tract, and you have to remove them, then she cannot have children anymore. So infertility. The next complication I would like to mention is death. I mean, if you do not treat it and it spreads, and and you say that you will fast and and pray it away, and and you go into the sick bush and they start to give you herbs that's not going to help you, and it continues to spread, eventually you will die. So yeah, I always like to refer to death as a complication. I don't know if it's a complication out, that is, I don't know if it's considered a complication, but I consider it a complication, because if it is untreated, yeah, death. And also it can also affect your daily, as the cancer spreads, it also affects your daily activities. So the more advanced the cancer is, the more the more sick the person becomes, and then you are unable to get things done for yourself. So you eventually gradually become bedridden, you lose a lot of weight, because the cancerous cells, one of the reasons why patients with cancer, especially advanced stages of cancer, they really lose a lot of weight is because the cancerous cells, they really, really, really consume. They have a high metabolic rate. So they really, really consume a lot of the nutrients that the patients take in. So because of that, you see the patients come in very, losing a lot of weight. There's something called someone become sick, losing a lot of weight, and becoming, unable to get things done for yourself, losing, energy, gradually depleting in health. Yeah, so those are all sequels of the cancer. So yeah, there are a lot,
Okay,
but
so
I just, like to those ones. Stop there.
all right. So before we go on, I want to say to those who are following us, yes, I already see some questions coming in the chat room. Yes, so sending your questions. We're going to have time for question and answer, and Dr. Supuwood will be responding to some of the questions. We already started talking about some of the questions in there that was already in our discussion. But yes, extra questions, please post it in the chat room, and then we come into question and answer right after this next 2 or 3 questions will be ending the discussion aspect, and will be coming to question and answer. So yes, whether you are joining from YouTube, you can send your questions. If you're joining from Facebook and other platform, you can send your questions in the chat room. We'll see it right here, and we will be able to respond to you. Yes, so we go over to you, Dr. Eleanor.
Oh, okay. So we've talked about management, we've talked about how it starts and everything. Any prevention, we have, how can we prevent this disease as we are creating awareness? What are we supposed to do? How do we reduce our risk factors, and the way forward with this cervical cancer?
Yes, there are several ways in which you can prevent cervical cancer. Number one, we mentioned that smoking is a risk factor, right? So if you love smoking, stop smoking. I mean, at the end of the day, the only thing that you're going to do is you're just going to smoke your lungs out, increase the risk of lung cancer, increase the risk of cervical cancer, increase the risk of a whole lot of different types of cancer, cancer of the throat, etc., because it's not just cervical cancer. So if you are smoking, stop smoking. When you don't smoke, or if you stop smoking, you reduce the risk of cervical cancer, lung cancer, cancer of the throat, and several other types of cancers. Number two, practice safe sex. Because we said the most common, widely known risk factor for cervical cancer is the human papillomavirus, right? And we also said that this virus can be transmitted sexually. So practicing safe sex helps to prevent cervical cancer. Number three, stick to one sexual partner. Men, please.
Genders, yeah.
But why you want to emphasize me on the men here? So we already talking the women's thing. I'm biased here now.
It's very important. You have to hit on that.
Of course, that he expects me to defend my gender. So I'm being very gender biased now, because at the end of the day, gender that gets affected with this because of someone's promiscuous habit. Yeah. So how do we prevent cervical cancer? We can prevent cervical cancer by having men that are promiscuous. Yes, I will mention that. Yes, and yeah. So stop having multiple sexual partners. That goes to the women too. So not having multiple sexual partners, sticking to one sexual partner, practicing safe sex is another way of preventing cervical cancer. For the young women that are coming up, the young girls that are coming up, do not get involved in sexual activities early in life. Wait, because the earlier you get involved with sexual activity, the more your risk is increased to prevent cervical cancer. And then, so for the human papillomavirus, going back to the human papillomavirus, which is a very major risk factor, you can also prevent the human papillomavirus because there are vaccines available for the human papillomavirus. Now, this virus is a virus that has several different types of strains. There are more than 200 strains of the human papillomavirus, but the most common ones that cause cervical cancer are the strain 16 and 18. I know there are some people on the line that were waiting for me to get to this part of it. So the human papillomavirus, there are several strains, but the most common ones that are really associated with cervical cancer are strain 16 and 18. And then there are other strains. There are 31. There are 45, 52, and several other strains. So there have been
go
vaccines.
slowly on that?
Someone is taking notes. People taking notes. So
Yes.
you need to be.
Okay, sorry. So the most common strains for human papillomavirus that cause cancer, cervical cancer, is the strain 16 and 18. Those are the most common ones that are linked with cervical cancer. There are other strains like 1, 45, 33, 52. But the 16 and 18 are the ones that are most commonly associated with cervical cancer. There are other strains also that are associated with genital warts, like the 6 and the 11, that may not cause cervical cancer. But there are several strains of cervical cancer, human papillomavirus. So going back to the human, talking about this virus, there have been vaccines that have been developed to prevent, and to protect against this virus. So there are 3 vaccines that have been developed for the human papillomavirus. The first one is called the Gardasil. It's GARDASIL, the Gardasil vaccine. So that vaccine is protective against 4 strains. So it's usually referred to as a quadrivalent vaccine. It prevents 4 strains of the human papillomavirus. It's the 6, the 11, the 16, and the 18. So those are the strains that the Gardasil vaccine is protective against. Then there's the bivalent. The bivalent vaccine is called Cervisex or something like that. I can't remember the name well, but that one protects against 2 strains. So that one is protective against 16 and 18. Then there's the nanovalent vaccine, which is protective against 9 strains. So you can have 6 strains, 6, 11, 16, 18, 31, 33, 45, 52, 51, and 52. So 9 strains of human papillomavirus for the nanovalent, and that one is called the Gardasil 9. So there are 3 vaccines available. Now, talking about the vaccines is usually the time to give the vaccine is before people become sexually active. So WHO and CDC have recommended that people give the children the children vaccines as early as 9 years. So the vaccine is for people who from the age of 9 to 26, you can take the vaccine. And the vaccine, the schedule, so from 9 to the vaccine is usually given 2 doses. So between the age of 9 and 14, you can give the vaccine 2 doses. So you give the first one, and then after between 6 to 12 months, you can give the second vaccine. However, if the child has gone beyond the age of 15, you can give them 3 doses. So, and I know people will be asking, so how about if I'm more than 26, can I take the vaccine? Yes, you can still take the vaccine. I don't know if it's been given to Liberians beyond the age of 26, but yes, you can still take the vaccine. So, like I said, if you're beyond 15 years, you will have to take 3 doses instead. In Liberia, we have the The bivalent vaccine available in Liberia now. I know one place that is available is at the Dubo Road Clinic. It should be available at GFK also, and I believe we can check all of government facilities and you will be able to get them there. So the bivalent vaccine is available here in Liberia, and can take 2 doses of the vaccine 6 months apart. And like I said, the bivalent vaccine is protective against strain 16 and 18, right? And those are the most common ones that are associated with the human papillomavirus. Now, another way in which you can also prevent cervical cancer is by doing Pap smear regularly. So from the age of 25, 26, you can do your Pap smear at least once in every 5 years. Because cervical cancer doesn't just come about. There's something called precancerous lesion. There's something called precancerous lesion of the cervix. Is so the Pap smear, when you go to do your Pap smear, and the precancerous lesion is from one stage, grade 1 to 3. So there's one cervical Intra Epithelial Neoplasia 1. That one is, it's non-cancerous, and there's 2 and there's 3. So if you do your Pap smear and you find 2 or precancerous lesion 2 or 3, that means your doctor will want to follow you up more closely, because your risk of developing cervical cancer is very high as compared to if you have cervical cancer, cervical intraepithelial neoplasia 1. So that simply means, that big thing that I just said, it simply means that you have abnormal growth of cells within your cervix, but it is not cancerous. So that's why it is referred to as cervical intraepithelial neoplasia. So there's abnormal growth, but it's not cancerous. It is benign. So yeah, I have talked a whole lot about the vaccine. So I know some people have gotten lost along the way. So if you have any questions surrounding vaccine, feel free to ask me. And yeah, I will try to clarify as much as I can.
Okay. So
Yeah, I think.
yeah,
I
please,
think
Eleanor, before we go.
you spoke at length about the youth, right? But we also spoke about the risk factor being peri or postmenopausal. So what happens to those in their menopause and within or out of their menopause? So what happens to them? They can't take vaccine. What happens in their prevention?
Well,
Management?
for those in the menopause period, it's advisable that they use the Pap smear instead. Sometimes you, if you have not taken the vaccine before and you go to the Pap smear, you can also do your HPV test to know if you have the HPV or not. So if the HPV test is negative, you can do continue the Pap smear in the 5-year interval. Yeah. So postmenopausal patients, people in the menopause, they can use the Pap smear instead.
How do they manage them? Do they have to just take off their rituals, or would also have to take some medications or chemotherapy, radiations?
Well, despite the age at which we present with cervical cancer, the management still goes back to the staging, like I said. So, cancer, the management of cancer, one patient approach is not a one size fits all. So, is usually cancer management is usually patient tailored. What do I mean by patient tailored? A patient might present with stage 1 cancer, or a patient might present with stage 2 cancer, and they might choose to give her drugs, the chemotherapy first, followed by the radiation. And another patient might present with stage 2 cancer, and she might be given only the neoadjuvant, only the chemotherapy as palliation. So it's really, cancer management is related up because a patient might present with stage 2 cancer, but she might, for example, have other comorbidities that may make her very ill and not strong enough to receive, aggressive management. So she would just receive palliative management like that, is trying to just manage the symptoms that she's experiencing. While someone else might present with stage 2 cancer that is fit enough to receive aggressive treatment. So despite the age at presentation, the management of patient cervical cancer and any type of cancer, it really has to do with the staging and the overall general appearance of the patient. Yes, so it's not, I cannot say to you that because the patient is postmenopausal, she would just do, hysterectomy. Yes, it's possible that if she's postmenopausal, I mean, she's not having kids again. So if the entire woman, everything into a complete radical hysterectomy. But at the same time, she might be very sick and might not be able to tolerate surgery. So she might just receive palliation. So the management is really based on the staging and the general, condition of the patient before clinician oncologists can decide, along with the co-workers that, hey, we should go this way or we should go this way.
Okay. Thank you. Now we're gonna go to the chat room and see some of the comments there and some of the questions. I think we addressed this one. What are some early signs and symptoms for cervical cancer? We talked about that already. So we go on, and then I think we talk about this data, and I see a couple of responses concerning that as well. Then the curable thing, I think we say yes, is when you present early, management is better. And I see that Bay Foley also kind of contributed. She said, but I would say it's the definitive diagnosis of cervical cancer. Yes, thank you for that, Dr. Foley. And she also contributed concerning the question about the data. I think she said the number that is reported is usually what is presented at different facilities where screening is done. So she believed that those who don't present are probably more than those who presenting, right? And so there is a question here, and I think we didn't talk about this. This is kind of more personal. You want to say something about this? A friend of
Yes.
mine is experiencing, yeah.
Yeah, a friend of mine is experiencing some painful urination, and she says sometimes it feels like her uterus is falling out. Any advice? The advice I will give you is tell her to please visit her doctor. Go see the gynecologist. Because I cannot say to you that she got cancer or she doesn't have cancer. So the best thing I can say to you is, go let her visit her doctor, the gynecologist, and then she can take it from there.
All right. So that question
Or she
is
can also
from
visit.
Lillian.
This looks like urination, painful urination. This also looks like something that's affecting the urinary system. So she can also visit Dr. Ayon Cassell, that's at GFA. He usually sees patients on Wednesdays, I believe. So he's a urologist specialized in he specializes in the urinary system. So this symptom here looks like urinary symptom. So she can visit Dr. Ayon Cassell or she can visit the gynecologist and they can help her out from there. Yeah.
So Lydian Boydman, that could be an advice for your friend and visit the doctor. Another question is here. This is from Victoria. And she say, hello, doctor. According to the international guidelines for a Pap Smear test, screening starts by age 21. What about if the lady is a virgin? Will you stay to a Pap Smear? Well,
If she's still a virgin at the age of 21, she's not sexually active. So what I would advise her to do is, if she has not gotten her HPV vaccine yet, I would advise her to do her HPV vaccine. To take her HPV vaccine. That is what I would advise her to do. Yeah, that is what I would advise her to do. And if she's smoking, she should stop smoking.
so in short, the answer is no. You won't do a Pap Smear.
I'm not saying no. I'm saying I'm not saying no. I'm saying she's not sexually active at that time, at that point. So she has not been exposed to, the HPV, the human papillomavirus. So the best option would be for her to take
a
the
vaccine.
vaccine. However, She's also, if she's involved in smoking, I'm going more with prevention now. So if she's involved in smoking, she should stop smoking. If she's smoking, she can go ahead and do her Pap smear. But if she's, yeah, so I wouldn't say no, but I wouldn't opt for a Pap smear with someone like that. Instead, I would advise her to go the preventive way.
So what am I getting? The Pap smear is taken on more maybe with patient presenting with symptoms or patients who have risk factors.
It's not just patient representation.
Yeah.
The Pap smear can be used more for diagnostic purposes and screening purposes.
Okay.
So you don't have to have symptoms before you start screening for cervical cancer. Okay, so going back to this person question, she can go for Pap, she can do her Pap smear because, like I said, there are precancerous lesions that she might need follow-up, that might need to be followed up with the CIN 1, 2, and 3. So she can do her Pap smear if she wants to, but it's not totally necessary because if the risk factor is not present, then there's really no need to subject the patient to, unnecessary expenditure. However, she can just observe her lifestyle and, and then later on she can, as she gets older, she can start her Pap smear. So the Pap smear is not just for diagnostic purpose, is for screening purposes as well, because if the patient has a precancerous lesion, like I said, they will need to be followed up to see if this lesion will become cancerous in the end or if it will remain non-cancerous.
Okay. So there is a contribution here. This is very long though, but let's see that. Until you understand how, okay, it's kind of responding to the issue of not trusting the data from Liberia. And this person is saying, until you understand how that data on cervical cancer was collected and evaluated for potential bias, you can say the numbers cannot be trusted. The average age for having first child as a female is 19 years in Liberia. And yeah, so I think the person is kind of contributing to the issue of not trusting the data in Liberia, that you can judge just that. So thank you for that contribution. I don't know who that is. And there's a question here. I think this is kind of personal to you, Dr. Supuwood. It's from Deddeh Kamara. You want to hit
being the
this?
first Liberian oncologist in training, what's your plan beyond providing medical services in Liberia upon return? Plans such as creating space for improved awareness, education, etc. Okay, so Deddeh, to answer your question, I have already started. Even though I have been away for the past 4 years, I do have a cancer page, and I am very, very, very heavy on awareness. People who know me, have interacted with me, they know that when I start talking about cancer with them, I always start from awareness. I always tell them, hey, I believe my work starts from awareness, because if people don't know what they are looking for, what to look out for, they will not know to come to the hospital. So yeah, in my little corner, I have already started my cancer page. It's called Basic Cancer Facts. Yes, so you can just check it out on Facebook. I try to make the information very simple and easy to understand. I try to remove, all my medical jargons from there. So I just try to send out simple information about cancer as a whole, not just cervical cancer. So you can check out my page. It's called Basic Cancer Facts, and I have been doing postings about different types of cancers. Coming back home to Liberia when I returned, yes, I still
Sorry, I think we have a break in the network there.
Can you hear me?
Yes, now we can hear you.
So yes, I besides process, I want to do a lot of awareness. That is why I always, when people reach out to me about coming on talk shows to talk about cancer, I'm always willing to come online to talk about cancer. because I believe awareness is the first step for us in battling cancer in Liberia. So, tell me, yes, besides providing medical services, I am very, 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 very heavy on awareness. If possible, you give me rain boots now, I will wear my rain boots and go in the marketplace and go and talk to our mothers in the marketplace. Cancer, about cervical cancer, about breast cancer, about cancer, and any type of cancer you want to talk about. So I am very heavy on awareness. I would love to do awareness, and I would love to create a space where more awareness can be done beyond my cancer page. So yeah, awareness. I actually love to do awareness.
Thank you. Thank you. Thank you. Somebody asked, I think this is gonna move. This is not gonna directed to our discussion today.
No, 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 no,
What is the
no.
role of service in
Please
a
bring the
cycle of
gynecologist
pregnancy?
online for this.
Yeah, so this is we're talking more about cancer. Yeah, we're talking about the service, but yeah, this is kind of more a
Gynecological
gynecologist will want
obstetrics.
to answer this. Yeah, except a general practitioner. Yeah, want to take on that, but I think we'll save this for the gynecologist.
Yeah.
So, do we see there's another question? Is there a question? Okay, someone is stay on this data thing. Those data can be trusted because an acute absence of diagnosis and screening tests in almost all major hospitals. There is an acute absence of diagnosis and screening tests in all major hospitals. How many hospitals do biopsy or Pap Smear of others
Yes, so
investigation tests? Data is 5.
just to just to comment on this cancer, this data thing. Like I said, I believe that we are honor reporting. And the reason why I believe we are honor reporting is because there are several factors involved. Number one, we did not have a pathologist in Liberia for many, 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 many years. Gladly for us now, we have two pathologists in Liberia that are GFA. So now, yes, for the last, I think 3 years, 3 or 4 years now, we have had a pathologist at GFA. So that has, like gradually improved diagnosing more cancer cases, because I remember back in briefly, I visited GFK and I went to the cancer management is a multidisciplinary thing. I was a cancer patient. I have to work alone. It's a teamwork. And my colleague took me around. And one thing he told me I was impressed. Okay, before this month, we used to have this biopsy done per month. But now he said within the last 1 month, they had the number had increased to more than 100 cases. It's if we have the human resources available, things will improve. That one is beyond my scope. We have a we have a pathologist report, the pathologist available now. Someone is saying that the reagents are in slots are constantly
But
available. That one is
so
strictly
no, we
available.
can't go to
That
that.
one
Except if we are
I cannot go
speaking,
into it.
except no,
Yes.
no, except if we are speaking from JFK with fight, right? So we're not going to dwell on assumption here. Yeah, this is
Exactly.
a
That's what I'm
medical thing
saying.
and the evidence. So
I'm addressing it from a realist, from a scientific standpoint. I know that we have had pathologists for the last couple of years, which has gradually improved things. We also have CT scan at JFK now, and other, we have Jamali now not doing CT scan. We have that
yeah,
got
the
CT
VA.
scan. So if we have yes, if we have the resource available and the necessary equipment, and now we are starting to do more awareness on cancer. I believe gradually the number will increase because, like I said, we have been on reporting because a lot of things have not been done surrounding cancer. Cancer is almost like a new field in Liberia, so there are a lot of people that don't know about cancer. So that's why awareness is important. So even after do the awareness, we should make sure that when we tell these people, if, for example, if I go in the marketplace and I tell the women in the marketplace, I say, Mama, if you see your blood, your period, it can be if you can normally use 2 towels a day and you notice yourself using 3 towels, or if your period can come for 5 days and you notice that your period coming for 10 days, go to the hospital. And the woman say, yeah, woman, daughter, thank you. Or if I tell her, say, mama, if if you see something nothing, if you notice nothing in your breast, go to the hospital. And then if I finish telling her to go to the hospital, the woman say, yeah, that's true. If she does notice any of the, and then she comes to the hospital and there's no oncologist available, there's no pathologist available, then where are we? You know what I'm saying? So gradually, the awareness comes along with having the human resource available.
The
It
human
comes along with
resources.
having
Yeah.
the instruments and equipment available. So that is it. Cancer, but I believe that we have been trying, and the Ministry of Health is trying, and I know that the Ministry of Health will do even more in terms of cancer, cancer in management in Liberia. So it's a gradual process. Rome was not built within 3 days, so it would take some time. But I mean, gradually we are getting there. Once upon a time, people used to have to try to go Ghana to get diagnosed with cancer. Now people can be right in Liberia and get diagnosed with cancer. So I believe, baby steps to get there. So yes, we are actually on reporting because there are several things in play. The people don't know they're supposed to come. That is designated for cancer patients. Talking about data, we should. I don't want us to go into it too much. We're going to it too deep. We will start going to politics, which of course I'm not interested as we are on
No.
reporting because a lot of factors are
Yes.
risk like calculated.
Yeah, I think from what the picture is. I was also in Liberia, so we are a few years ago. So at JFK, at Redemption, at Jackson Hebdo. So yeah, we should be speaking from fights from the experience. We're not saying all is there and everything is in place. That's not true. Nobody can boast it. Everything is perfect there. But definitely, what I can say is that over the last 2-3 years, a lot have changed. First of all, we didn't even, have oncology. Now we're going to be having a medical oncologist soon. It should be going, back and forward in training. So we didn't have neurosurgeon. We have one neurosurgeon right there in JFK. So now at least, trauma cases is going to be attended to. But come on, can he alone be able to solve all the neurosurgical cases in Liberia? Perfectly, no way. No way you're still going to have trouble. Even if you have 2-3 neurosurgeons right now, you're going to still have, some challenges, right? But definitely you can say the presence of one neurosurgeon and during the time there were none is the same. That's just not true. That would be assumption. So probably some of the awareness we are creating right now, in the absence of a medical oncology, you couldn't even be having this kind of conversation, by the way. So definitely there is a one step at a time. And of course, we didn't have pathologists for years. Now we have 2 pathologists, our own pathologists at JFK doing extremely well. So I think a lot is happening. We're not saying it's perfect, and we don't want to go political with this. And data is supposed to be center based. If it is still national based, fine. I mean, we're going somewhere, right? At least something is there, and we can work from that. And definitely, people are going to the point where we start publishing our own articles. We don't expect that a Supuwood to go to JFK and see patient for 1-2 years and she doesn't publish any paper in terms of management and things she's doing there. No, that's completely different picture nowadays, right? So we a lot is going on, and I think the essence of this discussion is to create awareness and not go political. We're sorry if there's any political conversation, we're not going to respond to that. Yeah. So thank you so much, Dr.
Thank you.
Supuwood, and we really appreciate your time with us today.
Thank you.
So before we go, I'm going to take over the screen now. Before we go, I want to do a couple of announcements and a couple of encouragement. I'm going to keep my guest right in the back there, and I'm going to take over the entire screen. Yeah, so thank you for joining us. We will stay see if there's any question that we can address. Stay have my guest and my co-host here with me. But before that, let me give a couple of announcements before we come to the end of this talk show today. So we are excited that you could join us. The International Christian Medical Fellowship, ICMFEL for short, is a Christian medical professional group that is reaching out to medical professional and creating medical awareness, and also reaching out with the principle of Jesus Christ. So we are Christians first, and we are medical professionals, right? So, and we feel that one of the way we can practice our profession is not just seeing it as a career, but as a calling. So we want to say thank you for joining us. So we will be glad if you can contact us. This is our email address. And you can also follow our Facebook page. On Facebook, our page is International Christian Medical Fellowship. So you can follow our page. You can join our Facebook group also. You just send a request to join. We'll confirm you. There are two or three questions you need to answer there. So if you are a medical professional, whether a nurse, a doctor, whatever paramedic, you can join our group. You can join our Instagram, and then you can also check our WhatsApp group. You can join us there. And also we want to encourage you, if you're interested in what we're doing, you can partner with us. We are partnering with the C365. It's a global online church, and there are a lot of other people we're partnering with that have been coming and working with us, who think the things we're doing, they are interesting. So you can partner with us if you're interested in what we are doing. If you think what we're doing is good and you have similar vision, you can partner with us as well. So we also, as Christian, we want to encourage our members and associates to, we notice that as doctors and medical professionals with our basic work schedule, sometimes we don't even have the time to read our Bible. Sometimes we don't even have the time to go to church. That's true. It's not because you don't want to go to church. And so one of the things we are doing, we are also reaching out to our colleagues. There are people who are depressed. There are people who are going through a lot. Because you are a doctor, you are a nurse, nobody really cares. They think you know everything. But we cannot be able to really serve well if we ourselves are not, in the right mind. So we coming out, we have a spiritual program, different things to be able to also take care of our awareness. And so one of the way we engage that as Christian is the youth version Bible app is something that's been around for long. Some of you may know about it, some of you may not, but we have a special reading plan there every month in collaboration with C365. And I have a lot that you can just read your Bible from your phone. You can comment there, you can ask questions, and you can be able to get in connection with people. We have a medical small group. So you can, this month, there is a reading plan coming out. You can follow this link. If you don't have the Bible reading app on your phone, you can just download it. And you can also follow this link on the screen, join a reading plan for this month, and you can be able to get in touch with our medical small group. We can be able to have discussions together there. So also, please, we want to encourage you to, you can watch this program. It's live on YouTube. On Twitter, you can follow our Twitter account there. It's also live on YouTube. You can go and watch it on YouTube. And please subscribe to our YouTube channel. We had a tremendous support when we just started the YouTube channel. In less than 3 days, we had 50 subscribers. But then we think people are gonna, okay, no, we need more subscribers. So please subscribe to our YouTube channel. If you are watching us, go to our YouTube channel and subscribe to our YouTube channel. We want you to follow us and be able to see what we are doing there. And there are many other things that come out during the week. Every week, you have inspiration with Dr. Ballah. You have a prayer team. We have worship hour, different things every week. In the midst of our business schedule, we still think we need to take care of our awareness, our mental, and our spiritual well-being as well. So thank you for joining us today. And I'm going to bring right back my guest to say bye-bye to you before we leave. Dr. Eleanor and Dr. Supuwood, thank you for joining me today. And thank you for the conversation. I think it was really, really great. And I hope that the Supuwood you're gonna come back again.
Yeah, it's always a pleasure, and it's interesting having. It's very interesting to talk with.
So any parting word, Eleanor?
Thank you.
Yeah, I think this topic was very important. The awareness. We don't always have to wait for those special months, cervical awareness, and all those things before we create the awareness. But in our little corner, we have to brighten and create the awareness. And I think that's what Dr. Supuwood and the International Christian Fellowship is trying to do. So I would encourage that our audience would also spread the good news, what they've learned from here, and they impact the world with it in their own small corners. That is what they can do to help the female gender to also multiply. So, Dr. Supuwood, it was awesome having you, and all the best in your study. It's awesome that you are a female too. So, great, good luck.
Thank you, Dr.
You, and then make you a better person for the society and the world at large. Thank you, Dr. Ballah,
Amen. Thank you.
for
Any
organizing.
parting word, any goodbye word, Dr. Supuwood, before we say bye-bye?
Yeah, I just want to say thank you to the International Christian blah blah blah.
Medical Fellowship.
Medical. Thank you for having me. Yeah, this is my second time around, and I really appreciate it. I mean, I felt like I must have done something good the first time for you to want me back on your show the second time. Thank you for having me here, and I know that I will be back again to discuss another type of cancer. So, my listeners out there, thank you for joining us. And I hope that you were able to learn something today. Please help us to spread the word that cancer is real and it exists in Liberia. If you have a mother, an aunt, a big sister, a small sister that is experiencing any of the symptoms, please, encourage them to visit a doctor. If you have a girl child that is between the age of 9 years and above, 9 and 15 years, please encourage them to, please take them for the HPV vaccine because you could be saving the life in the future. God bless each and every one of us, and may we all have a wonderful weekend.
All right. So my parting word is that we all should be able to get up and do something, wherever you find yourself. The criticism is good, but you should be doing something to solve the problem. And I think that's the best way we can be able to make the entire world a better place. So get up, start doing something, start contributing to the many problems that we have around, and start, bringing solution to the table. And with that, I think we can be able to solve many of the problems. And from the Christian perspective, we're actually just preaching whole sermon here. We're preaching against, sexual immorality, because that is a contributing factor to cervical cancer. So please, be faithful and be a good Christian. God bless you, and we hope to see you again. Bye-bye.
Bye. And subscribe to our channel.